Well, I'm with David Ashford, the Minister for Health and Social Care. I have to say we're recording this at 1 o'clock on Tuesday. We now know you're going to be making a press conference at 4, so this might be quite out of date because you're not going to tell me anything, I'm sure, that's coming up. Well, okay, but I've got to bat it off, haven't I?
Yeah, we go through it.
Are you going to come out with anything dramatic at 4 today then?
No, it is a general update briefing. I need to make that absolutely clear. There's no need for anyone
Even
to panic.
Now? Okay.
It is still a general update briefing. There is nothing we're seeing in terms of wider transmission currently in the community. So unless that changes between now and 4, that is the situation.
So do you need one at 4 then?
The cases, well, I think it's important to update the public because we did say on Friday at the briefing that we would update as soon as we got more information. We know we had the case off the Noodle Bar where we said we were going to do wider surveillance testing. We're now getting in those surveillance testing results that aren't showing up anything unexpected. So there you can have a bit of breaking news ahead of 4 o'clock. Because it's people already in isolation that are high-risk contacts that the positive case is being announced. So there's nothing at the moment to be concerned about, but we said we'd give the public a full update when we had the information available to do so, and that's coming through this morning. So it's wise for me to give an update at 4 o'clock this afternoon.
In part 2, by the way, we'll do the Q&As which we got here, but I just wanted to get as much as possible out of you while I've got you here today. The steam packet this morning, the Chief makes a statement in the House of Keys. What did he say exactly? Yeah,
so it's nothing new. The statement stated what we'd already gone public with on Friday, that we'll be engaging with the steam packet to look at how we resolve the issues that have come up so that everyone's on the same hymn sheet.
But why is he making a statement today when he hasn't had the actual investigation yet? I mean, isn't it?
It was asked for. It was asked for by members for the Chief Minister to make a statement. So it was a requested statement to the House.
And you said when we had our last press conference, you were meeting on Tuesday with the steam packet. I have to look back on this when I went. You said the official meeting. So you've had other meetings, but this one today, have you had it yet, or was it?
So my understanding is there was meetings yesterday, I believe now, Monday. I believe there was some meetings yesterday, and I believe there will be potentially further meeting today.
There's a lot of jargon here to cover. You know.
No. It's been quite clear.
I understand.
There was the case of, obviously there's constant contact between public health and the steam packet, but I wanted to be clear with you on Friday that the actual formal meeting, so actually sit down face to face, talk to them,
with
was
you?
This week. No, not with ministers. It's done by public health and also the team.
So they've had their meeting.
Yes.
When are we going to hear about it?
So we will update as soon as we can. There'll be things to be worked out. Obviously, the initial meeting is just talking about the issues, and then they've got to find a way through those. So it's not going to be an instant process.
You didn't honestly really believe that all the steam packet members were all self-isolating, did you? I mean, did you?
Yeah, in the January and in fact, I know people that actually have done so. I've spoken to people who have been doing so outside, so we're aware of the process. But it seems somewhere there's a breakdown in communication, because clearly wider than that, people didn't know that. I think what's important is we need to work with the steam packet forward as to how this is going to go, because you can't have people in permanent self-isolation.
That's what I mean. You can't have thought
that to live their lives.
That's what I mean. You can't have thought.
And that's why, as I said, at the time of the variants coming out, as I've said in reply to several individuals who contacted me, I think that was a sensible measure. But it's not a measure you can sustain long term.
You can't have thought they were doing it for 9 months, can you? I mean, did no one think about it? I mean, I didn't think about it, and probably no one else probably.
Well, things have changed over time at different points, and certainly the most recent, order, it dates from January. Yeah,
I mean, it's not rare that often we get stuff from the steam packet. But when they contacted me on that press conference, it was a bit of a wow, because I think we all assumed, like you, that things were working tickety-boo. Then this case comes up, and it's all along though the steam packet workers didn't have to. Well, they couldn't, as you keep saying, self-isolate.
Well, the direction notice to the steam packet is quite clear on the process they need to follow. It's a company direction notice, so it's a direction notice on the company, the corporate entity. So the steam packet should have been aware of the contents of that, but we need to park that, and we need to work with them on how we go forward.
Because I've seen one of the exclusion orders, whatever, not the exemption orders, and it appears the government were correct in what was being said on that, so it is on your side, but clearly it wasn't someone. Well, if it was the case, then they should have been checked up on all the time, shouldn't they?
Well, no, because it's a corporate exemption, so it would be up to the company.
The whole company
to
got
ensure
exempted.
it. So it would be up to the company to ensure that the corporate exemption is applied, because the exemption notice is on the corporate body.
So how do you move forward from this?
Well, like I say, we need to have discussions with the steam packet, and what we need to do is come up with something practical that allows people to continue to live, but equally protects our island community. And that's why it's important that our public health officials and the team who run the travel notification service that runs the borders and everything else meet with the steam packet, sit down, we have the proper discussions, and we come up with something that can work going forward for both sides.
So nothing has changed since last week at the minute?
No.
The processes and everything, they can go home, they can do what as before?
Well, they should be following the direction notice.
It's not breaking the law, though,
They should be following what's in the direction notice.
Is that breaking the law?
Unless that direction notice is changed.
Is that breaking the law?
So it is breaking the direction notice.
So they're breaking the law, and therefore there's all sorts of potential ramifications. I mean, clearly no one wants that.
The direction notice is still in force.
Wow. So what happens? Do the police have to get involved, or do you just turn a blind eye? Oh, no, that's the wrong word, but do we have to carry on? We have to have a lifeline
well, at the moment,
service.
let's let the discussions with the steam packet go ahead, and let's come up with a practical solution to move forward that will actually allow us to work with both sides, so that the crew aren't in permanent self-isolation, but equally we can manage to have measures in place that ensure the protection of the island, and that our island community doesn't end up with seeded transmission from us. I've got to put on record though, Paul, I think the steam packet crew themselves have done a brilliant job over the last 12 months. This is the first real sort of incident we've had off the back of the steam packet, and the fact that this has only come to light now shows that they have been working exceptionally hard on mitigation measures, and they've done very well themselves. So let's not prejudge the way things are going.
And the last thing we need though is industrial action. Or everyone's saying they're not going to keep to those things. So it's clearly got to be sorted out. This is a question of more meetings.
Well, let's not over dramatise things. Processes have been in place. Yeah. It now appears those processes, for whatever reason, be it misunderstanding, miscommunication, haven't actually been being followed, which in the way that it was being thought. The practical solution is everyone sits around a table and comes up with a clear, defined process going forward that benefits both sides.
I got contacted by someone from the steam packet. They tested positively, but that was the second test. The first one was negative. They're still feeling unwell. They have another one a few days later. That's positive. The wife's gone down with it. Here we go again. This is another chink again because it's a steam packet worker, someone that is on board. I can't say much more because I don't want to disclose the person.
You will always have that with testing. That is that actually ties into the mantra that I think I've bunged out probably 150 times now.
But
testing is a point in time.
He shouldn't have got it in the first place. That's probably, isn't it?
That means there's protocol issues in place, which is why we need these meetings to address that.
Yeah.
But you'll never. I mean, one thing you've got to say is though nothing is ever 100%. You can put the best run processes in the world in place, but you will never get a cast iron 100% guarantee. You're dealing with a hidden virus at the end of the day. But the important thing, and we've got to emphasise again, you're given the opportunity to do so with testing, it is a point in time. Testing tells you at that sample point whether someone potentially is infected. We also know if someone's in the early days of incubation, which this person may well have been, that they will come back negative despite having it, and then this person's now had the second test which has come back positive. So that ties in exactly with what we've been pushing out there for the last 12 months.
Okay, as I said, questions in the second half, but I mean, one of the biggest ones constantly now is about, are we not, being too relaxed in the sense of the social distance? I know you dealt with this one this morning on the radio as well, but it is of concern to so many people.
People will, quite rightly, at the moment be concerned. There will be a lot of people out there in the community feeling vulnerable. We probably are going to see more people wanting to social distance, wanting to wear masks through personal choice. At the moment, there is no need to bring in those recommendations because we are not seeing wider seeded community spread. The cases we are seeing coming through, which people are seeing trickling through in the figures, is high-risk contacts that have already been identified, already had contact tracing done on them, who are already in isolation. So there is not the wider onward spread of transmission. So again, rather helpfully, I think the way to compare this is what we laid out at Friday's briefing, which is this is more like what some have taken to call in the 1886 cluster, rather than what we saw in January. Where it was much more widespread and we had cases where we didn't know where they were coming from popping up.
It's almost interesting that people almost wanted to go back to social distancing, or certainly the people who are contacting the media maybe almost. And there's nothing stopping people putting on their masks, I know that, but there is a certain feeling in town when you see people like that, It's a kind of weird one, isn't it?
Well, the thing I would say is there shouldn't be that fear.
No, I know.
You know, we shouldn't treat people any differently.
Yeah.
I know that maybe there will be people who think, why are they wearing a mask? The person might have very, very legitimate reasons for doing so, and you know, it's perfectly feasible for them to do so, and they should be respected for the decisions they make. At the moment, there is no need for us to bring in any additional measures based on the information we have. Obviously, situations are always fluid. If that changes, the public will be the first to know. But I think one of the things you've emphasised there is just how responsible the Manx public have been. We've seen that throughout the 12 months.
It's incredible.
And the way
we are very
and
responsible.
The very fact we have people who are voluntarily saying, you know, we should be considering masks, we should be considering social distancing. I think that emphasises again what a wonderful Ireland community we've got.
Well, I've joked, I said if you said stand on one leg while you're in a queue or something, I think you'd find everyone would stand on one leg and do it because it's good and bad.
I wouldn't try it myself, I'll probably fall over. But
there's, you know, I've been light-hearted, but in fact, the Isle of Man appears 99% very compliant to whatever you might.
Yeah, and they've been reaping the rewards of that for the fact that we have, with the odd cluster bump in the middle, we have generally now since June, July time last year been able to go about our lives generally as normal.
I can believe it's come up to a year since it already. No. Look, we'll have a part two. He's on his lunch break, by the way, because he has a key, so I'm conscious of time. Let's do part two, questions and join us back.